Howdy friends, Tulio here from the Pena team at Keller Williams Partners, and I'm here with a good friend of mine, Dr. Grove Higgins. He is the founder and he runs NeuroAthlete here in Monument, Colorado on the west side of the interstate. He's my chiropractor and a friend of mine for many, many years, and we're gonna take a look at what he does.
Yeah. Well, welcome to my clinic. This is my clinic in NeuroAthlete in Flying Horse Medical Center up here in Monument. It's beautiful. The reason we moved up here is because of all the beautiful views of the mountains up here and a great community.
Before we go in, tell us the address.
The address is 77 3rd Street in Monument, Colorado, suite number 400 if you need to know more.
All right, let's check out the inside.
Sounds good.
All right, so we're inside Dr. Higgins' facility here. Tell us a little, obviously you have a lot of gear, you have a lot of equipment and wonderful toys.
Yeah.
Tell us about your exercise and stuff like that.
Well, one thing you'll notice right away is that we have very few offices and a lot of space. And why is that? It's because we're always trying to teach the client, the patient, how to take care of themselves. So I don't try to spend all my time in there. I try to get my patients out here and make sure that they've got all the skills that they need. So that way they don't have to keep coming back for the same old stuff. But like people like yourself, you're a high user of your body. We're here to keep you on top of your game.
Right.
So between our space and our clinical space, that's what you'll notice. And so we have everything from weights to things that allow us to biohack your system, so that way we can get the most out of your body and out of your life, ideally.
Right. I've been coming to Dr. Higgins for many years at different locations over the years as you've moved. And what I love about him is he's not your standard just get an adjustment chiropractor. And there's nothing wrong with those chiropractors. I think that's a very profound form of treatment, but he looks at the whole body. And he's very knowledgeable in the area of strength and conditioning, and he's helped me as well as his staff has before with not just getting treated but teaching me how to maintain myself with exercises. So before I do my strength training or my cardio days, I do about a 7-minute exercise routine that's yoga-ish, breathing, different things that your staff has taught me to help maintain myself. And I really appreciate that about you guys. But aside from exercise and some of your modalities here, you're known as a soft tissue specialist. Share a little bit about what you do that's different than other chiropractors from a soft tissue standpoint.
Yeah, so what moves all of these joints, all these bones that need to be aligned really well are muscles. And there's a lot of other soft tissues that are attached to them. And what I use is a technique called active release technique, among other things, but that's one of my big guns. It allows me to get in and find areas where there's scar tissue and areas where there's no mobility happening, get in there, target it very specifically, and restore it back to its full health and motion fairly quickly. And then it allows me to do the chiropractic side of things much easier, and ideally, I see, not just ideally, in reality, I see much better results over a long period of time. And then I don't have to keep seeing you for the same problem all the time, because we miss the soft tissue.
Well, what I have found from him doing the active release techniques treatment on me over the years is that I feel that truly alleviates the muscular, the neural issues, the shooting, the stabbing, the tingling, the aching, any of that type of stuff over one to sometimes a few treatments, 3 or 4, gets rid of it. And then the adjustments, because the soft tissues pull your spine out of alignment, hold so much longer. It's more long lasting, it's more effective. It all comes together when you treat the muscles, the ligaments, the tendons, and free up the nerves, and then do the adjustment rather than just to do an adjustment.
Definitely, and ideally you walk out, if you're performing better, you get more out of your exercise, more out of your life, even as a realtor, and just enjoy things better. And then when you and I get together, we don't have to work so hard to fix problems that unfortunately life just throws at you.
What are some conditions from a soft tissue standpoint that some people that may be viewing this might not think you or say a chiropractor in general would even tackle?
Yeah, so we're talking about repetitive motion injuries, and one of the most common ones, especially with people working from home now, is lots of forearm pain and discomfort, even considering carpal tunnel syndrome and those types of things, where your hands are numb, tingling, painful, weak, those types of things, where you can't open a pickle jar anymore, those types of stuff.
Right.
I see a lot of those from, especially since the pandemic and such like that, working at home, and it's not hard to fix, and then it's not hard to teach the person how to keep that from happening on their own.
Well, let's do a demo. Let's go in your treatment room and show people like how you would work on a forearm or maybe a tennis elbow type of a condition. Would that be cool?
Sounds great.
All right, let's do it.
All right.
Okay, so Doc, the other day, my team and I were doing a whole bunch of mailers, and we were stuffing envelopes, and we sent out like 400 letters, and we literally folded the letters, put them in the envelopes, used the little wetty thing to seal them and everything, and put the stamps on. At the end of the day, I was like, man, it's like when I twist over from here to here, I can feel some tightness going on and a little bit of tingling actually going into my hands. I knew exactly this happened because of doing a ridiculous amount of repetitive activity.
Yeah.
What do you do?
Yeah, so between that and then of course you use your phone a lot, I know that.
Right.
So this hand gets used a lot for that. So all the muscles that make that grasping motion allow you to be dexterous with a envelope and such, all those muscles live in this area here. So it's really easy to understand that those muscles get worked and sometimes overworked and misused a lot. And so like for you, a really good one right through here, there's a muscle that comes across here that allows you to turn your hand over. And what are you doing all the time when you're folding? You're doing this thing all the time. So this muscle right through here is pretty tight on you. So let's treat that.
What's that muscle called?
That one is called pronator teres. There you go.
I was going to guess that.
Yeah. Well, you remember your anatomy from school, I think, right? So anyway, what we're going to do is I'm going to shorten up this muscle, and I'm going to take some tension across it. The problem with you trying to stretch this muscle is that when you go to stretch it, the whole thing tries to stretch, but where there's a problem, that won't stretch. So I'm going to use my hand, my thumb here, to get in on that muscle, set some tension on it, and so then as we're pulling that muscle tight, we can get it to stretch where you need it, right? So now instead of just a general stretch, we get a really specific one that helps to break up that scar tissue, get blood flow back through there, and ideally start getting it moving better so that way it doesn't cause you this difficulty. The other problem, you got a big nerve that comes through here that goes through that carpal tunnel, and it can get irritated. So I can find that nerve, I can get some tension across that, and so then now as we're pulling you through this, now I'm holding that muscle this way so that nerve can go beyond the muscle and we can get it to unstick, and then that nerve doesn't get so irritated. Unfortunately, that muscle right there oftentimes is mistaken for carpal tunnel. People get carpal tunnel stuff all the time, and it's really this pronator teres, and this is an easy thing to treat. Carpal tunnel's not.
So something I've learned from receiving this treatment for many years and just learning about it and asking a lot of questions, people go, well, is this like a form of massage? And it's hands-on soft tissue. So in that respect, kinda, but I would say this is the PhD of massage. It's extremely specific in what he's doing. He knows exactly where he's putting his thumbs, and he's doing the movement of my body causes the muscle or the soft tissue to slide under his contact instead of his contact, his thumb moving over a bunch of muscles at once. That specificity, getting in between the muscles that are glued together with what he called scar tissue, is what frees it up and gets just a really profound improvement.
This is like I associate this kind of like surgery, but without having to open you up.
Right.
Getting my tool in there, getting that area and breaking it apart, or breaking apart those adhesions, and it's like going in there with a knife, but without the pain, without the recovery, and it doesn't cost as much.
So that's why they call it active.
Yeah.
It's not passive. You're not just laying there with a therapist or someone doing this on your back. You are actively involved in it, and that specificity is just, you feel it when he's doing it. Sometimes it's not pleasant, but it feels right when you're getting it done. And that's what's so cool about this. That's why when I asked him, can I come do a video with you? Every time I leave this place, I want to call someone and go, you need to go get this. It's amazing. If you have tingling, numbness, shooting, stabbing, aching down your arms, your neck, your back, your legs, your feet. He's worked on stuff before on me that I didn't even think a chiropractor could handle. But because of his certifications, he and his years of doing it, he can figure out stuff you would never have thought of before. So have a seat over here with me for a second.
Yes, sir.
Yes. All right. How long have you been in the business here? Or not just here, but doing
something. I've been in healthcare since 1993, and got my doctorate in 2005, and have been doing chiropractic work and manual therapies ever since then. And I also teach anatomy, and so I think between that and then the awesome team that I have here, we're able to address a lot of problems for a lot of people, going all the way from grandma sitting in the rocker to the office worker sitting in his office and doing his stuff, to the world-class athlete. And
Right.
so we get a lot of opportunities to work with a lot of different people, and it's very gratifying.
Okay, cool. Tell me just if you can do a list of 10 types of conditions that you feel, and it doesn't have to be 10, but things you feel you really rock at, that when people come in, you're like, I know I'm going to make this person better.
Yeah, so I mean, backs and heads and necks, that's a staple. A lot of people have that, even if they come in for something else, they've always got back pain. So that one's the number one probably. Shoulders, I'm awesome at. Shoulders are particularly hard because they're complicated joints. They move a lot, and unfortunately, we have bad posture, especially with technology, so they become a big problem. But we get a lot of people with chronic pain, and a lot of times it's nerve pain, and it gets elusive, and they go to doctor and therapist over and over again, and they start to lose hope. And one of the things that we're really good at is digging deep and finding some keystone problems that allow them to start getting relief, and sometimes, a lot of times, full resolution after years of problems. So nerve-driven pain that's been around for a long time.
Mm-hmm.
Yeah.
What would you say for an average condition that comes into you? How many sessions would you say it takes you to resolve or greatly improve?
Well, it's not a good business model, but I usually get them done in about 2 or 3 sessions. But the nice part with that is that then the person's feeling really good. They go out, they live life more than they were before, and they come back with new problems.
Yeah.
And those new problems they earned, and we can give each other a high five, and we can feel good about working on that problem, getting them back out there.
That's how I feel about Dr. Higgins and his team here, what they do. I come in on a regular basis because many of you know me. I exercise a lot. I beat myself up, and I think if you do that to anything in life, it needs maintenance.
Yeah.
And I come into him to maintain it. He's my body technician, and he takes care of me, and he figures me out really well, and I leave here on cloud 9, to the point that I had to share this with you guys. So, brother, thank you so much. I really appreciate your time today.
Definitely.
And tell people how they can, once again, find you, your website, phone number.
Yeah, so the easiest way to find us, if you're online, you can search for NeuroAthlete Clinic up here in Monument, but our website is clinic.neuroathlete.com. You can also call us directly at 719-225-4949, and Mary will help you out. She's our patient care coordinator. And when you come, just come prepared to move and to experience change, and just keep your mind open to the possibilities of things being not just different, but better, and not just better, but great.